Greetings. For those of you who don't know me, I am Dr. Dustin Williams, internist by trade and the founder and lead educator here at Online MedEd. When I started the company, I started with the brand promise to the students that I was making the videos for that medical knowledge belongs to no one. So medical education should be accessible to everyone, which is why the videos are free and they always will be. Last year at AAMC, we announced with a 4-year solution, and we as a company came to you, the faculty, medical schools, with a new brand promise. We were to be your exceptional educational partner, not just a vendor and a customer, but a true partnership where we help facilitate doing what you do, making the best doctors possible. And so it made a lot of sense when I heard that students were having their rotations canceled and that schools were looking for solutions to bridge this COVID gap. It made a lot of sense just to say, hey, Case X product, you can have it. And so because of that, I thought I might take a little bit of time to explain what it is. Right? Our videos are beloved by students because it teaches them the foundations at the level they need to know it. 0 standard deviations from the mean, the classic presentation, the algorithm workup. But you and I both know that's not how life works. Medicine training is experiential. Nothing can take the place of caring for a human being, of taking the responsibility and ownership, learning about that person and that person's presentation of disease. But if the students can't do that, they need something that approximates it. Enter Case X. Case X was initially intended for 4th-year medical students after match. Mitigate skills decline. 6 months of interviews and easy rotations, 3 months of taking it easy and getting ready for graduation. We wanted them to have something that was doable without a lot of time commitment, but it was of increased value to them. After match, they know what specialty they're going into and can choose the cases that are relevant to them. It's intended for a 4th-year medical student to bridge the gap between being a student and being a resident. As a student, they conduct an H&P, mine the EMR, present to their senior, and get told what to do. As the senior resident, they'll be presented to and make the decisions for the student. Intern year is about that transition. Case X goes after the critical thinking, the clinical reasoning, the medical knowledge component of that transition. And so, while some of the questions might be a little too advanced for a 3rd-year student, it does what having a real patient does. Students are expected to learn a little bit about everything, but their experience, their patients, they're supposed to know a lot about. That's what Case X can do. So what is it? Case X is a full H&P, not a documentation thing, right? You get a full history and physical. And then is a series of questions that follow the case that challenge the learner to go further, go beyond black and white, to go beyond the algorithm, answering the difficult questions that actual residents had to answer. Every case, there's 97 of them, starts with a patient video. It is a real patient in a real situation in a real scenario, not an actor, not a standardized patient. That links that experience piece to the case. It's not some esoteric thing someone made up. It's a real person with a real case. They get the video, the HPI written out, review systems, and the usual stuff that you'd expect, past medical, surgical, social, allergy, family. And then the physical exam, vital signs. It's the chart. Then they get the EMR, where we have labs, EKGs, imaging. And we have actual images, not just a description. The learner gets the first shot at interpreting whatever the film is, and then they can click a button to see the interpretation. When they get to the end of the case, Case X begins. There's a series of questions they have to answer. The first question is usually pretty easy. Right? What's the diagnosis? What's the differential? Are they septic? And then it gets to something very advanced as they get further along. What we do also is the case continues. We withhold information from the learner in order for them to be challenged to answer the question without the information that they know they need. once they're forced to deal with the question, then they get the information, right? The idea is we don't want them admitting the patient to the ER already worked up. We want them thinking about working up the patient as if they were the only provider present. And so as they answer questions, they get new information, unlocked information from the EMR, new information phoned in, collateral for a family member, or simply an update in line. And so that each question unlocks the case, and so the case unfolds like it would in real life. Now, it doesn't simulate the hospitalization experience or a follow-up in clinic, but it gets the idea of you have to be able to think clinically and without the information that you're usually provided. And then once you know you need to get it, then you provide with that information. Why this eases your pain is because it satisfies a lot of the concept behind experiential training. They are associating this case with that person. The person in the video is this case. It's not fabricated. The real people, the real cases, the real problems that residents had to deal with. And they're questions that are easy for you to answer as an attending provider, but as an intern, they struggle with over and over and over, year after year after year. And so now as a student, they're going to be engaging that content, thinking like an intern. It doesn't take the place for having a real patient, for doing the physical exam, for putting in the orders, but if they're not able to see patients, it's a pretty good approximation. And so I also want to talk to you about how to use it. I'll tell you what I did. So before CaseX existed, I would have students in my clerkship have access to online med ed core content. They were expected to do independent study, cardiology the first week, pulmonary the second. And while they were doing independent study in pulmonology, in that second week, they would come into student school and they would do cases together. Now, the whole business of this is that we're not trying to have people come together, so that experience alone is not going to work, but I strongly suggest that students do the core content first so that they have a solid foundation and then challenge CaseX. You could do it online in groups, you could do it independent study. But I'm not trying to sell you our third year core content, because if you use CaseX and you read an answer explanation from one of our expert attendings, the student doesn't understand, there's a link to the core content. The videos are free. And so in closing, I want to tell you that we have this thing, CaseX. It's a really good product. And it's designed for fourth year medical students transitioning to intern year. But it is the most like a real patient experience that you're going to find. And we're giving it to you for free. Because we are your excellent educational partners. That's CaseX.